One of the really nice things about DREAMM-7 and DREAMM-8 is that they did fairly extensive quality of life instruments associated with treatments in both arms. And so what I really enjoyed about this data set was that it gave us a pretty comprehensive view of what was going on. And while there were some impact on visual acuity and things like reading or driving, they were fairly limited, and actually the quality of life over time actually improved for patients who were on Belantamab. And given that there's so many people, talking about the ocular events and side effects, it's very reassuring that when you hear from the patients who were on a randomized phase 3 trial, they actually describe their quality of life as being better over time compared to the control arm. With belantamab mafodotin, the big concern by both patients and doctors is the ocular issues, the microcysts that occur. And what we know about this from a large number of patients that have been treated now is that it does always reverse. And one of the little quirks in the grading system is that there are two ways to evaluate ocular events. The first is an ophthalmologist looking at the cornea and counting the number of dots or where the dots are. The second is looking at a Snellen eye chart and being able to read. You pick the worst of those two, and that's the grading. So it's not uncommon to see grade 2 events where patients have no impact at all on their ability to read or drive. And so that dichotomy is really important for patients to understand.